Most of the women who come to us are concerned about how to calculate their gestational age once they conceive. So today we will be talking about the methods required for calculating the gestational age. First, we will learn what is the importance of calculating the proper gestational age. See, when the pregnancy occurs, when it has occurred, it is very important to know what is the gestational age and how it is calculated. Why? Because it will be important when there is any fetal growth restriction to know how is the growth of the baby and what measures should be taken to improve the growth and whether the delivery is required and when to do any intervention for any growth malformations. As well as according to the gestation, we decide what sonographies to be done for assessing the various anomalies in the baby, and if by any chance a pregnancy is to be terminated, then also we can decide the various methods of termination. So a woman should know her gestational age so that she can help in any emergency to the doctor and she can tell it to them. How to calculate? Usually we tell the woman to calculate from the last menstrual period if they have conceived naturally and they have a regular menstrual cycles. Total duration of pregnancy is 280 days, which is 9 months, 9 calendar months plus 1 week. It is being calculated from a last menstrual period on all the females who have conceived naturally and have regular cycles. If the women are having irregular cycles, that is, their cycles are prolonged or they have short cycles which are having more than 35 days or less than 21 days of duration, then they should then we rely more on the ultrasonography done at 6 to 8 weeks of pregnancy. They are more reliable for calculating the due date. Most of the females have 28 days cycle. If they have a 28-day cycle, usually the ovulation occurs at 14th day of the cycle, and after that the fertilization occurs if the female partner has met with the male partner sexually. After that, implantation occurs 7 to 8 days, and 7 to 8 days of implantation, the positive beta HCG is seen on the urine pregnancy test. So when the female gets a positive beta HCG test on urine pregnancy, usually she is already 4 weeks pregnant. And hence, in these women, we told them to calculate the gestational age from the last menstrual period. After 2 weeks of a positive beta HCG test, we tell women to go for an ultrasonography for the gestational age calculation to see the number of fetuses and whether the cardiac activity has come or not at 6 to 8 weeks of pregnancy. In women having irregular menstrual cycles, first trimester sonography done at 6 to 8 weeks is very important for gestational age calculation, and therefore all the women are recommended to have an early antenatal checkup so that a proper ultrasound can be done at the proper date to get an exact gestational age. If the woman has conceived through the IVF pregnancy, then the gestation is calculated from the embryo transfer date. Usually we add 2 weeks from before the embryo transfer to get the proper gestational age of the woman. Calculating gestational age is very important, and again we advise all the women to know their proper gestational age for any emergency measures required, and we recommend them to know and be aware of the duration of the pregnancy which they are in and what all can be done to calculate their gestational age.